know that women's health is national priority, especially for this government. Now, what key policies or initiatives is the presidency championing to improve maternal and reproductive health outcomes in Nigeria?
So, I'd first like to acknowledge that women's health is finally moving towards the center of national agenda, right?
Yes.
And I have Mr. President to thank for that. I mean, in the history of the country, this is the first administration that has an office for women's health. And that's something to celebrate. And as far as the key priorities, right? I want to advocate and let the world know that women's health is not just about our reproductive organs. But in as much as I want to do that, we also have to take into account the national priority. Nigeria records the third highest rate of maternal mortality worldwide, and that's climbing. So of course, the national priority is crashing down the rate of maternal mortality. And as far as the initiatives, I mean, one key one that we all know is MAMI, the Maternal and Neonatal Mortality Reduction Innovation Initiative that is fully championed by the Honorable Minister for Health and Social Welfare, Minister Pate. And that initiative is getting in multiple stakeholders to make sure that we bring that number down. And I think we know that they're taking a statewide approach. It's not just about what the government can do. It's about that, but it's also engaging private sector, NGOs, citizens, anybody who wants to get involved to say, hey, a woman should not die giving birth. So that initiative, MAMI, is the top priority, right? That the nation is championing, and it's underway. I love that. Another thing is improving access to reproductive health services, because of course, even to bring down the number of maternal mortality, we first have to address the ratio, population, and the age of women getting pregnant, right? And also putting the autonomy of family planning into the hands of women. So improving access to those services, I think that's another initiative that we are championing. But also, like I said, it's not, even though that's the priority, we are looking at all of the spectrum, even the non-communicable diseases, everything that affects the entire livelihood of a woman, let's just say, from adolescence until menopause, really. Yeah, so the MAMI initiative, I would say, is the top priority. And even though this is a new position for me, I have not come in with the mindset of what innovative solution can I come up with, because there is no point reinventing the wheel. There are no policies that's out today that somebody has not already designed. The problem is not the policy, the problem is implementation. The problem is working in silos. So my office exists to say, hey, how can I collaborate with what is already happening? How can I collaborate with the Ministry for Health, the Ministry for Women Affairs? What can I champion, really? It's just really about getting more foot soldiers, and I'm happy to be one of the foot soldiers, basically.